Hello, my name is Warren Rutherford, and I'm the owner of the Executive Suite in Hyannis, Massachusetts. Today I want to talk to you about the RxCut Plus Equalizer card. The RxCut Plus Equalizer card has been developed so that it can guarantee card users to receive absolutely the lowest prices possible on your prescriptions. And that's in one of three areas. It could be your insurance copayment, the pharmacy's retail price, or the Rx cut price. In any event, you could be assured that you will always be paying the lowest price. I want to ask you, can you be assured of that now? Here's a graphic of the Rx cut card that I provide to folks that are interested, my clients and friends. This is something that you would present very simply to your pharmacy the next time you go in to renew or start prescription medication. Why is this important? Well, in the pharmacy industry, pharmacy benefit managers, or PBMs, are third-party administrators of drug claims in the U.S., and they're responsible for negotiating deep discounts with the pharmacies. They've developed preferred drug lists for their clients, and they negotiate discounts and rebates with drug manufacturers, and that results in inflated pricing of prescriptions. Interestingly, 3 of those PBMs control over 86% of the prescriptions processed every year, and in 2009 alone, the revenues for those top 3 PBMs was only over $80 billion after their drug cost deductions. You may not be aware, but over 210 million Americans get prescription drug benefits managed by PBMs. We're often charged a copayment for a generic medication that's higher than the retail price and the RxCut discounted price. The RxCut price on 19 of the 25 most frequently prescribed medications are lower than the insurance copay of $10. The Equalizer card is specifically designed to stop you as a consumer from being charged your insurance copayment when the retail price of the med is actually lower. How do you do this? It's quite simple. You register your free healthcare discount card with your pharmacy the next time you go in to visit and start or renew a prescription for medication. Ask your pharmacist what the pharmacy Rx cut price is when purchasing your medications. They're quite used to this. They'll go, probably, oh, one of these again. Shrug their shoulders, register your card, and they will give you the Rx cut price. Sometimes it's less, sometimes it's more. But the fact is, once you register with them as a consumer, they're obligated to inform you. This free RxCut Plus healthcare discount program provides discounts of up to 75% on certain prescriptions. And what's interesting, there is absolutely no cost to you to use the card. It is accepted at almost all pharmacies. The way you find out, you ask. There's no enrollment or activation fee of any kind. You can go online, do a pharmacy search, use the pricing engine that allows you to add multiple medications and search multiple pharmacies at once, listing them in order from the lowest to the greatest. Oftentimes you put in that medication information, you put in your zip code, press the button, and within seconds you've got at least a comparison of 10 pharmacies and the cost. It will tell you pretty much before you go to the pharmacy whether or not your RxCut card is going to be less than the prescription price or the copay price. So I'm often asked, and was asked this morning, what's the catch? Well, you're leveraging an enormous number of people who need help paying their medical expenses. So the RxCut card program is able to negotiate deep discounts with service providers. We collect a flat rate administrative fee for each transaction, and that covers our expenses and commissions paid to our distribution network and only when we save our card users money. It's really a model of win, win, win. The card user ultimately wins as you're guaranteed the absolute lowest price at the pharmacy as either a result of your copay, the retail price at the pharmacy, or the Rx cut price. Well, I continue to be asked, okay, Warren, so what's the catch? Quite simply, you're paying whichever price is lowest. This is the only card that equalizes the transaction at the pharmacy counter. It's not like other card programs. It's that simple. How does it do it? The PBM, the middleman's removed from the equation, and it allows our deep discounts to be passed along to you, the card user, at the pharmacy counter. RxCut Plus is the equalizer in healthcare. It's beneficial to all: the insured with generic copays of $10 or higher, the uninsured, of which there are many, the underinsured, of which there are increasingly many, and those with high deductibles, and finally, those who fall into the so-called Medicare donut hole. So, the card guarantees that you as a user will always receive the absolute lowest price possible on your generic prescriptions. Our price on 21 of the 25 most frequently processed generic drugs for card users has been less than an insurance copay of $10 or more. So ask yourself, do you want to save on your prescriptions whether you have insurance or not? If you're interested in getting your free RxCut Plus Equalizer card, please go online to the website listed here by simply clicking on it, or email me, Warren Rutherford, at wjr@theexecutivesuite.com, and I will mail you any number of RxCut cards that you need for yourself, for your family, for your employees. If you have any further questions, again, please email me. I'd be happy to explain these to you. Is it too good to be true? It's true. I've used it, and it works. Thank you very much. This is Warren Rutherford, providing you information on your free RxCut Plus Equalizer card.